Most of the time, you don't even know you have that disease and you don't feel anything. Hello everyone, and this is a new episode of Doctors A and B. I am Dr. Nadia Abel Hassan, Dr. A,
and Dr. Joanna Valentine, Dr. B.
Okay, so this is our third episode, and we started this podcast because we have a lot of people come to us very constantly with questions about dentistry, and now that we open a business and scaled in multiple locations, they have business questions, and we're both working parents and they want to know, how do we do all this and run a family? So we are using this platform and we can answer your questions as well. You can just go ahead and either ask us questions with the comments below, or you can leave us a DM. A lot of people has been giving us and sending us private messages, and however you want it, and we're gonna make sure to answer your questions. So today we have a pretty cool topic that everyone gets related to once you go to the dentist.
Yep, so it's very, very important because one of the biggest things we talk about when a new patient comes in is what type of cleaning? What type of cleaning should you be getting? And, there's a range from 6 months Brophies all the way to, deep cleanings and perio maintenance. So we're throwing all these foreign language to people, and a lot of times they don't know what you're talking about. Like, what is deep cleaning?
Exactly. They come to you and they say, why is this person getting a Brophy and this other person getting a deep cleaning? Does it mean the deep cleaning is a better cleaning because it's more thorough? No, it's not. It's just for a different diagnostic. And today, we're going to definitely make this clear for you in a very easy way. So, a patient comes to the dentist and we're doing an exam, and all of a sudden, we have to go and we say we're going to check your gums and your bone level, right? And the way we do it is, I'm going to give you right here an example. If my hand in here is the tooth and this sleeve is the gum, then we bring a perioprobe, which is like a ruler. It's an instrument like a ruler, and we measure from the top of the gum to where the bone is. And then you hear the dentist go 2, 3 through 4, 2, 2, 3, 4, 4, 4. Yeah. So those numbers they all have meanings, and the meaning for the numbers 2 to 3 means it's normal. There's no bone loss, because we're trying to make sure that there's no bone loss. And if it's more than that, it's either, and then it starts to go into a range, which is they can ask to diagnose that the person either have gingivitis or periodontitis.
Yep.
And what is periodontitis?
Yeah, so periodontitis is a condition. It's caused by bacteria, which is totally different than the ones that cause the cavities. So these bacteria mainly create problems with your gums. And what happens is you have the bacteria that start to make plaque and tartar, and it's all over your teeth, all over your gums. It first starts out with a little bit of inflammation. Your gums get a little puffy, you may get a little bit of bleeding, but there's no bone loss. If this inflammation goes on for a long period of time, some people actually start to see their bone and their tissue basically disintegrate.
Exactly.
And this is what we call periodontitis, or a lot of people will call it gum disease.
Exactly. And what she's saying, for example, if there's a lot of bacteria around your tooth, it's going to go under the gum and do the damage under the gum. By resorbing the bone goes down. Do you really think people know that? Like, most of the time, you don't even know you have that disease and you don't feel anything. And the way I can right now relate to you so you can understand exactly how this feels is people that have high blood pressure, they don't even know they have it until they go to the medical doctor, they check their blood pressure or something, and they are diagnosed that they have high blood pressure. And what do? They take a blood pressure medication. And that blood pressure medication controls the blood pressure. And that's good news, because if your blood pressure is controlled, it's like you don't have the disease. But if it's not, it's really dangerous. It's like a bomb inside of you ready to explode. And you don't want to go very long with a high blood pressure without diagnosing it, because the damage can be really bad. And same thing with the gum disease that is called. It's more bone disease than gum disease, but that's how most everybody in the population knows it. They call, I have a gum disease or I don't. And, if you know ahead of time, then you can treat it. But if you don't, the bone is going to keep going down and down, and bone doesn't come back. So what is lost is lost. And sometimes, yes, you can do a lot of treatment for it, but you know what is lost is lost. So for every disease in the medical, the dental, and anything in the body, the earlier it's diagnosed, the better the solutions and the better the outcome. Yeah. So make sure you get your dental exams, because the dentist is the person that can diagnose, and that's how you see what kind of clinic you are.
Yeah.
And talk a little bit about the difference between the Brophy and the deep cleaning. How is it done?
Exactly. So with a Brophy, you know, like you mentioned about when we do those gum measurements, you know, when it's under 3, there's no space, you know, there's no pocket, basically.
Exactly.
So with a regular cleaning, the patient is healthy, there's no space under the gums. So we're basically cleaning everything above the gum line. You know, we're cleaning the tops of your teeth or the whites that you can see, and a little bit along the gums. But patients that have gum disease, they have this whole space under the tissue that bacteria,
exactly like this.
And all that bacteria goes down there, and in a regular cleaning, we don't go down there because it's unnecessary on a healthy patient. But when you have gum disease, there's this space that bacteria will grow, and that's what's going to cause that infection to continue.
Exactly.
So usually we'll recommend what we call deep cleaning, or SRP, and basically what the hygienist or the doctor will do is we'll give you a little bit of anesthetic, and we'll go under the gums and flush everything out from underneath. Remove all the plaque and all the tartars, and this will allow your gums enough time to kind of heal and, you know, go back to an infection-free state.
And what is the interesting thing that what she's saying is, like, what happens if you don't do it? If you don't clean down there, and if you just do, like, you get some people go like, why can't I just get the regular cleaning? I don't want to get the deep cleaning. If I'm not cleaning where the bacteria is, it's almost like a fake cleaning because it's not doing the work. If it's under the pockets, you have 5 millimeters, your toothbrush and your floss is not going to go all the way 5 millimeters or 6 millimeters down. So it's leaving all this bacteria right there, doing their party and doing their work without being interrupted. And that's very, like, it's really dangerous, because that's how you can lose. And it's so bad because it's not like affecting one tooth. It usually affects a lot of teeth. So if you lose it, it's not like you're going to be losing one. You can lose a lot of teeth with that disease. Very important, if you ever have been diagnosed with periodontitis, to do the correct treatment for it. And if you haven't been to the dentist and don't know what your diagnostic is, or to the medical doctor, make sure that you go and check for your blood pressure, and make sure that you check your teeth too. Very important, so you can have long-term teeth. And again, like when they're doing the deep cleaning, you go all the way down. And how do you maintain this? Because when you have a blood pressure, the doctor gives you all this medication, and they tell you, you take this many milligrams. That's working. And they keep checking to make sure it's working. For us, it's like this. We check it, we diagnose it, then we do the deep cleaning. But later on, how can you cannot just do the one deep cleaning. What do you do later? You do what we call perio maintenance, which is, instead of having a cleaning every 6 months, like the other one that was the one that is not losing pockets, that not losing bone, you have it more often, because those bacteria that cause the deep cleaning, every 3 months, they group together and start the damage again. So very important to stop them right in there so they don't keep damaging your bone.
I'm so glad you brought that up, because that is so important. I have so many patients, you know, who will get so scared that they have this gum disease, so they're all on board with the deep cleaning, and we get everything all cleaned up, and then we don't see them for a year. And it's like the same problem all over again.
So it's like a year not getting the cleaning under there. Like, you know, you cleaned it, but you have to replace the oil in your car. It's not gonna work. You don't do it once. It's the consistency, and it has to be done correctly. You can't have one time you go 6 months later, and then the next time 3 months, and the next time a year. You know, it's not gonna really be effective with the disease, and the disease is pretty dangerous. And do you have any other questions that you're very used to?
Talk a little bit about how a lot of times it's hard to diagnose gum disease sometimes because of other things that may be going on in a patient's life. Like a big one that I see is like smoking. I feel like that's
because
huge.
Gum disease, usually people that have it, they're like, I have bleeding gums. They come to the dentist right away. So where's your chief complaint? Where's your main thing? My gums bleed so much. That's an indication. It doesn't necessarily mean that you already lost bone, but you're pretty much on the way there. If you don't take care of it.
One of the symptoms.
It's one of the symptoms, you know, taking you there. Yes, it could be only gingivitis, which means only the gums are affected, which is the beginning of the problem, right? Only my gums. So the bone, you didn't lose bone yet. It's just going to be so long before the bacteria is going to really do the work on the bone. So what happens is so when someone smokes, right, the vessels constrict. This is why they end up with a heart attack. This is why the risk of a heart attack is bigger. Why? Because the vessels constrict. So if you have a blockage, it's going to clot way faster, right? Because it's already smaller. Or if you have more stress, then it constricts even more. This is why they associate that to a heart disease. In our mouth, if you're a smoker, your blood vessel constricts, so you have less bleeding. So we're doing all this measurements and you don't see bleeding. You go like, does this person have the gum disease? Because it's a symptom. Guess what? Right away, when you see bone on the x-ray lost and you see the gum not bleeding, the question is, are you a smoker? And that's how you're gonna know. It's very important, for sure, the relationship between the doctor and the patient to be correct, and the doctor know all of this so they can diagnose correctly.
And why it's scary too is not only can we not diagnose, but it's harder for us to even control the disease on those patients, I feel like. Yeah. It's almost like it progresses quicker, and it's more difficult to control it for sure. So, just to reiterate, it's really important that you guys stay on top of your cleanings and the gum health, because so many times people, forget about it. They're aware of cavities, that type of thing, but they don't realize how important managing your gums are as well.
And it's totally two different groups of bacteria. The ones that we talked about in the previous podcast about cavities, we're talking about the bacteria that cause cavities, a totally different bacteria that causes gum disease. And they're not, some people, they had never had a cavity, but they have a lot of bone disease, which is periodontitis. And, and it can go vice versa, but two of those group of bacteria can really cause damage and have people lose their teeth. And because we're talking about tooth loss, we're going to make sure the next podcast we're going to discuss, if that happened to you, what do you do to replace a missing tooth?
Yep, so make sure you don't miss it and you come back next month to watch it. We'll see you next time.
And until next time, my friends, be boundless
with an iconic smile.
Bye.